Please be advised that the information in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult a practicing medical professional. Thank you for your attention and enjoy today's episode. What is up, cooties and germs of the internet? My name is Tony, and you're currently tuned into Hemp Nerd, the podcast that helps you know your cannabis and cannabinoids so you can get reliable therapeutic results all the time. My hope is with this particular show and endeavor. Anyway, today's episode, we're actually going to be jumping into the question: does CBD oil work for polymyalgia rheumatica? If that's how you say it, polymyalgia rheumatica or PMR. Yeah, and I'm going to be using, I'll just shorten it to polymyalgia for the sake of simplicity, or maybe even PMR as we dive into it. But that's the question we're actually going to be diving in today. So we're going to be looking at that and seeing whether CBD oil is a viable treatment. And as you know, if you are a regular listener to this show or to this podcast, then you know that the first thing we must first establish is what PMR is, or what polymyalgia is. So the opening question for today is: what is polymyalgia? So polymyalgia is an inflammatory disorder that causes pain and stiffness in your muscles, joints, and soft tissue. The word polymyalgia means pain in my muscles. Or not pain in my muscles, but pain in many muscles, where poly means many, and myalgia means muscle pain. So polymyalgia rarely develops in persons under the age of 50. It is most common among people above the age of 50, and the average age of onset of this particular disease or disorder is about 70 years old. So the areas of your body where you're most likely to be affected by polymyalgia are your shoulders, your neck, and your hips. Now, what causes polymyalgia? So the cause of polymyalgia is unknown within the medical community, and I found this pretty interesting, right? When I was doing my research to actually answer this question, first understanding the problem, because obviously I'm not a practicing medical professional. The closest I'd qualify myself to a practicing medical professional is maybe I call myself a medical researcher, right? But I even think that is of some high esteem to what I actually do, because I'm actually an entrepreneur. But in order for me to provide a solution to the problem or the problems, I must first understand the problem to the best of my ability that I can. So I found it pretty interesting that in the medical community, and I read a bunch of websites, right? Like from the Mayo Clinics to the Health Lines to what other website did I reference here? Let me just quickly scroll down for you here. Arthritis Australia. Yes, I mentioned Healthline already. The American College of Rheumatology, Musculoskeletal Australia, or MSK Australia. Yeah, and for the most part, the medical community at the moment does not know what causes polymyalgia. However, they do believe that it is an autoimmune disease. If you're unfamiliar with what that means, an autoimmune disease is basically a disease or a disorder where your immune system attacks healthy cells in your body. Now, in the case of polymyalgia, the immune system is believed to be what attacks your joint tissue and your muscle cells, or the cells in your joints and your muscles, causing inflammation, which is the primary symptom here, and then pain and stiffness that follow. Now, the medical community also suspects that genetics and environmental factors play a role into the onset of polymyalgia. It is believed that certain genes and gene variations increase your susceptibility to getting polymyalgia. Now, causes of polymyalgia tend to be cyclical in nature, leaning towards seasonal triggers, and a potential environmental trigger such as a virus is suspected to play a role, but no specific virus has been shown to cause polymyalgia or PMR, which again I find pretty interesting. All right, so its specific cause as to what actually causes this condition, this disorder, this disease, is still a mystery in our medical community. So according to the American College of Rheumatology, recent research suggests that inflammation in PMR involves the shoulder and hip joints themselves and the bursae or bursa sacs around these joints. Now, if you've listened to my last episode on whether CBD oil helps for bursitis, then you understand what the bursae are, because that's something I just learned about in my previous episode. So, as I do each episode and as you stick along with me on this journey, it seems like the dots are connecting, because I just learned about bursae or bursa sacs in the last episode when I was looking at bursitis, and here we are looking at polymyalgia, and the American College of Rheumatology are saying that it involves the bursa sacs around the shoulders and the hip joints. Now, what are the symptoms of polymyalgia? So symptoms include severe stiffness and pain in your neck, shoulder, and hip muscles. Symptoms usually occur on both sides of your body, and they develop really quickly and tend to be worse in the morning or after long periods of inactivity. So if you can imagine yourself doing, let's say you've got polymyalgia, for example, if you're in a long road trip, for example, a long road trip would activate symptoms of pain and stiffness because you've been sitting down for an extended period of time, let's say 3 to 4, 5 hours, depending on how long that road trip actually is. Now, patients have also reported flu-like symptoms, including fever, weakness, fatigue, depression, and weight loss. Now, side note, I actually found this a bit funny because at the time of recording this particular episode, it is currently, it's May 29th. And, when I hear flu-like symptoms, it's 2020. So when you hear flu-like symptoms, the first thing you think of is COVID-19. So I found that pretty funny when I was doing my research for polymyalgia, and they said patients also reported flu-like symptoms. All right. I was like, okay, so COVID-19 it ticks that box. So you're telling me you could have polymyalgia. Let's say, okay, this is something that played in my head. This is way off topic, okay? Warning, way off topic. So let's say you had polymyalgia and you've got the pain and the stiffness and everything like that, but then you also reported flu-like symptoms. Would that qualify you to have a COVID-19 test? Question mark. Because they are saying COVID-19, if you display flu-like symptoms, very mild flu-like symptoms at best, then you potentially have COVID-19 and you go for a test. But then in the same vein, in the same breath, here I am doing my research on polymyalgia, and patients have also reported flu-like symptoms. So would that qualify you for a test, even though you've also got the pain and the stiffness involved? What call is your doctor or the doctors? What are they going to make in the height of COVID-19? I don't know. Just a weird thought. Thought I'll throw that out there. I'm not saying, I'm not citing, I'm not trying to throw any ideas in your head, so to speak. I'm just asking the question. But look, they also include fever. It also include, like other symptoms, also include a fever, again, which is COVID-19. It ticks that box anyway. Weakness, fatigue, depression, and weight loss. Now, though polymyalgia is an inflammatory disorder, it does not cause swelling in the joints or muscles, making it difficult to identify, which I also found pretty interesting. So it's like a really mysterious disease, this one. Doctors don't know what causes it. And, the inflammation, they say it's an inflammatory disorder, autoimmune in nature. However, even though it's an autoimmune where your cells are, your immune system is attacking your healthy cells, for some strange reason, well, I wouldn't say some strange reason because I'm not a doctor, so I wouldn't know. Maybe a doctor can actually enlighten me on this. But it's interesting that it doesn't cause any swelling in your joints or in your muscles. So it actually makes it a bit challenging for doctors to actually identify. So here's something interesting I found out as well. So about 15% of patients with polymyalgia actually develop another condition known as giant cell arteritis. Now, don't confuse that as arthritis. This is arteritis, abbreviated as GCA. So GCA is the inflammation of your arteries in your head, most often in your temples. All right, so your head, like literally the thing that's on top of your neck. So GCA can cause headaches, vision difficulties, jaw pain, and scalp tenderness. So not only will you experience inflammation, I guess based on my research, inflammation in your bloodstream, which you're about to find out how they learn or how they figure out or identify and diagnose that you've got polymyalgia. It can also lead to, apparently in about 15% of patients, it can also lead to inflammation of the arteries in your head, around your temples most often, which can again lead to headaches, vision difficulties, jaw pain, and scalp tenderness. So it's a bit of a curvy one. This one, it's not straightforward. It's a bit of a curvy disorder or disease, and the doctors haven't actually figured it out yet. They don't know what triggers it, and they find it difficult to diagnose, which we'll find out pretty shortly as well. And it causes another condition to arise. And it is possible for you to have polymyalgia and GCA at the same time. That's what I've learned so far anyway. So, what's the current treatment for polymyalgia? So, due to polymyalgia not causing muscle or joint swelling at all, inflammation is detected through blood tests. Now, the tests result in abnormally high inflammation found in your blood. However, doctors also need to rule out any other conditions such as rheumatoid arthritis because polymyalgia is that difficult to detect. So they do have to go through like a process of elimination just to make sure it's not something else that's causing inflammation in your bloodstream, and it is absolutely as close to 100% as possible that it is polymyalgia before they can actually start giving you treatment. Because when you look into what you're about to learn about the treatment, what I've learned anyway is that it's not sexy. It's not sexy treatment at all. So if your doctor suspects that you have polymyalgia, you receive a low dose of a corticosteroid. One, I think it's named prednisone. I can't even pronounce this word. Prednisone or prednisone or prednis1 to reduce inflammation. If polymyalgia is present, then stiffness can be alleviated in as fast as one dose of the corticosteroids. However, some patients, and I think it's a majority of patients, report a slow response rate to corticosteroids. So typically, a patient is on corticosteroids for a few months up to a year under the supervision of the doctor, because what your doctor is trying to do there, which is something I read and is not actually in my blog. So if you're listening to this podcast, this is some extra information for you. What the doctor is trying to do, what his or her goal is to help obviously alleviate the symptoms on the lowest dose possible of the corticosteroids, and you're going to learn why shortly. And it's basically the side effects that they come with, but that's what they're trying to do there. So if you do get put on corticosteroids, such as the one that I cannot pronounce, we'll just call it prednis1. We'll call it prednis1 because that just sounds like it's out of Hollywood. It has to be under the supervision of your doctor, and your doctor is trying to give you either reduce or give you the lowest dosage possible. At the same time, you experiencing alleviation of the symptoms. Now, I also found that this is interesting. Non-steroidal anti-inflammatory drugs, so NSAIDs, such as ibuprofen and naproxen, are said to be ineffective for polymyalgia treatment according to the American College of Rheumatology. However, according to MSK Australia or Musculoskeletal Australia, NSAIDs and over-the-counter pain medication such as ibuprofen and naproxen, I think that's how you say it, these are all new medical terms to me, can provide temporal relief of pain and stiffness. So it depends on where you are in the world. If you're in America, over-the-counter drugs and NSAIDs, they say that they won't work. They're ineffective. Whereas if you're in Australia, it is actually different. They're here, which is where I am at the moment. NSAIDs and over-the-counter medication can provide temporal relief. Of course, when you're sick or unwell or in pain or your muscles are stiff, you're not looking for temporal relief. You're looking for permanent relief. I think that's what we're all looking for. Like I'm sick. Between me and you, I'm sick and tired of temporal relief. Like I want permanent relief. I want my problem to be permanently fixed. And that's the goal here. That's what we're hoping to find out with CBD oil and cannabis for medical purposes moving forward. And that's why I'm diving deep into this education and broadcasting what I find on a weekly basis. Now, the problem with corticosteroids is that they can cause unwanted side effects, especially with long-term use. Potential side effects include high cholesterol, weight gain, loss of bone density and strength, which is a condition I believe is called osteoporosis. Osteoporosis, that's how you say it, and high blood pressure, so hypertension, diabetes, and the clouding in your eye lenses, cataracts. So that's what happens. Those are the side effects you're most likely to experience if you are on corticosteroids for a long term. And a long term is considered any time that exceeds 3 months. So 3 months or more is considered long-term use, and that's when you start experiencing those side effects, which are pretty nasty if you think about it. Again, let's go through them. High cholesterol, weight gain, loss of bone density and strength, osteoporosis, high blood pressure, which is hypertension, diabetes, and the clouding in your eye lenses, which is cataract. So you're just going to get more more diseases, more disorders. Like your body is basically gonna lose more. It's just gonna stop working. It's gonna be working. It will be way less efficient. It's just gonna get more diseases. Now, to counteract these side effects, your doctor will recommend a daily vitamin D and calcium supplement. Supplements are normally recommended if you take steroids for more than 3 months. So there it is. There it is. That thing is again. So long term is considered three months or more. The side effect profile of corticosteroids has led to people wondering whether cannabis in the form of CBD oil is a better treatment option for polymyalgia, which leads us to the question of the moment. Does CBD oil work for polymyalgia? Now, based on my personal research so far, right, not just this particular piece that I'm talking about, but everything that's led up to this piece so far, I believe that cannabis in the form of CBD oil will work for the treatment of polymyalgia. The anti-inflammatory properties of CBD and other non-psychoactive cannabinoids have been studied in human and rodent models of arthritis, which is also an inflammatory disorder that affects joints, muscles, and connected tissues. And specifically with rheumatoid arthritis, that's an autoimmune disease, which we already understand what the definition of an autoimmune disease is: your immune system attacking healthy cells. Going back to that 2000, if you're familiar with my content, you're familiar with this study, but hopefully I can shed more light in regards to polymyalgia. But in 2005 rheumatoid arthritis patient study, a cannabis-based medicine called Sativex was used to determine the effectiveness of cannabis against rheumatoid arthritis. Rheumatoid arthritis, like I just mentioned earlier, is an autoimmune disease that causes inflammation, pain, swelling, tenderness, and stiffness that leads to the immobility and deformity of your joints. However, the main symptom that this study was actually targeting was pain brought about by the inflammation through rheumatoid arthritis. Now, the study first found that the significant pain relief effects were observed in patients that took the CBM, the cannabis-based medicine, over the placebo. So they observed, significant pain relief effects. And I personally believe that was the case because of the anti-inflammatory effects that took place as well. But secondly, the study also found that the disease activity of rheumatoid arthritis was significantly suppressed. So in the patients that took, in fact, I'll just say it the way I wrote it in the blog. So this means the patient's immune systems actually stopped attacking their healthy cells. And this also means that the patients that took the CBM over the placebo had reduced or alleviated inflammation due to the suppression of rheumatoid arthritis activity. Okay, so what that basically means is the people that had the cannabis-based medicine, the people that took Sativex, which was a 1-to-1 ratio of CBD and THC, had the condition was suppressed. So the healthy cells, the immune systems, the patient's immune system stopped attacking healthy cells, right? In those healthy cells no longer being attacked, inflammation was no longer induced. And inflammation no longer being induced, they stopped experiencing pain. That's how I see, based on everything I'm reading and understanding how these diseases work, and then how these medicines counteracting these diseases, and then how CBD or cannabis plays a role in this, especially the anti-inflammatory effects of CBD. This is how I see the chain of events happening within the human body. Okay, so again, the way I see it happening is that a patient who takes the CBM or takes CBD, I said the CBM because that means cannabis-based medicine, but specifically CBD. The CBD suppresses, it suppresses the immune system. So it's immunosuppressive. It suppresses the immune system from attacking healthy cells, and it's also anti-inflammatory. So whatever inflammation is going on, that gets stopped as well. But more importantly, because the immune system is no longer attacking healthy cells, no more new inflammation is being caused, and any pre-existing inflammation is being reduced. And then because of that, the patients are also experiencing less pain. But because in Sativex there's also THC is known to be an analgesic, which basically means it has pain relief effects as well. And you can go read all about that. Again, with everything that I blog about, everything that I podcast and blog about, why not? I blog first, then I podcast. All the references to everything that I mentioned are at the bottom of every single blog post. All my reference links to all the different studies and all the different websites that I'm reading to understand all this information so I can bring this information to you is at hempnerd.co. Just find the blog post with the same name, or I want to say the corresponding name, but the same name as this particular episode, Does CBD Oil Work for Polymyalgia? And you find all the links there. You can go nerd out on that information. Maybe you can help me shed more light onto this topic. Now, the clinical trial also, where was I here? The clinical trial did not demonstrate significant toxicity, okay? And the CBM was well tolerated by patients. So there was, it wasn't dangerous. Like the CBM, the cannabis-based medicine, was not dangerous for the patients, and the patients tolerated it very well. The researchers concluded, so the researchers from that study concluded that the CBM provided significant pain relief, anti-inflammatory, and anti-arthritic effects. The researchers of this study also pointed to a rodent model study published in the year 2000, which we've spoken about as well in this podcast and on my blog. And in this study, CBD was found to block the progression of collagen-induced arthritis, which I call CIA, because again, that's what you abbreviate it to. But this was in mice, in rodents, okay? And it produced clinical improvement for the rodents. Now, the study found that the daily administration of CBD in mice with collagen-induced arthritis inhibited the progression of arthritis. So the same effect, right? The same effect in rodents in the year 2000 was more or less, but more, I would say more, established in humans as well. So in 2000, in collagen-induced arthritis in mice, they found that the administration of CBD inhibited the progression of the arthritis. And then they found again in 2005 that CBD inhibited the progression of rheumatoid arthritis in humans. So it suppressed the disease. And so again, what am I trying to say here? Again, the autoimmune system, or the immune system stopped. The autoimmune system. What am I saying? The immune system stopped attacking healthy cells. The inflammation got reduced, no new inflammation was created or formed, and pain relief was experienced as well because of the lack of inflammation. Now, the study showed that the synovial cells from the mice treated with CBD released significantly less TNF alpha, so tumor necrosis factor alpha. So we're getting a bit into the details, the nitty-gritty here. And it was less TNF alpha than the synovial fluid of control mice. So control mice were obviously mice that had opposing conditions to the mice that had CBD. TNF alpha is an inflammatory cytokine produced during acute inflammation. So it's I personally believe it's a pro-inflammatory cytokine, if I'm reading that correctly. And the researchers observed that the anti-arthritic potency of CBD is a result of immunosuppression and anti-inflammatory action by way of reducing TNF alpha in the synovium. The study concluded that the data showed that CBD has a potent anti-arthritic effect through its combined immunosuppressive and anti-inflammatory actions, which is basically what I've just been saying this whole time. It's just that when I write it down, my thoughts are much more clear and constructed in a way that just gets straight to the point, all right, instead of me rambling on. So the study concluded, and I'll just repeat this, the study concluded that the data showed that CBD has a potent anti-arthritic effect through its combined immunosuppressive and anti-inflammatory actions. Okay, so it stops your immune system from attacking healthy cells, and it reduces any pre-existing inflammation that you may have in your system. Now, in a 2018 peer-reviewed journal, the authors state that CBD has been demonstrated to be useful in the treatment of different inflammatory ailments, including bowel diseases like Crohn's and ulcerative colitis. I don't know if I'm mentioning that correctly. And neuronal diseases, including Parkinson's and Alzheimer's, and a wide range of inflammatory skin diseases like atopic dermatitis and psoriasis. The authors go on to state that from a pharmaceutical point of view, CBD represents at the moment the most promising compound present in cannabis sativa, or in cannabis. Although this component is well known, many of its antioxidant and although the component is well known for its antioxidant and anti-inflammatory activities, so it's well known that CBD has got anti-inflammatory activities, a number of researchers pointed out its ability to interfere with cell proliferation, apoptosis, and cancer growth. So, it interferes with, what is apoptosis? That's something I'm meant to look up. I'm going to look that up. But it also interferes with cancer growth. So, if you're familiar with cancer, right? It's not something I wish anyone to actually be familiar with. I wish we didn't even have to know about this, but we do, right? It actually interferes with the growth of cancer cells or cancer growth. So I guess the way I'm reading this from what these researchers are stating is that it interferes with the progression of cancer. So let me keep reading what they're saying. If we consider also that cancer biology and inflammation share several common pathways in some stages of their biological processes, CBD might be a potentially important tool in the control of cancer spread and growth, which is basically what I've been trying to say, but he said it better than me because obviously he's a medical practitioner. But yeah, so my final thoughts on this is that, look, through the studies that have been made publicly available at the moment, they provide enough data that conclude that CBD provides potent anti-inflammatory effects. So do I believe that CBD will work for someone with polymyalgia? Absolutely, yes. Cannabis in the form of CBD oil is a viable and effective form of treatment for inflammation and pain caused by polymyalgia. I personally believe it will work, especially if, I mean, look, doctors don't even know what causes it, and the only way to diagnose it is to check the inflammation in your blood. So they're looking for inflammation. So there is inflammation going on. Why not use CBD versus, I don't know, a corticosteroid that's going to give you other conditions? And I believe this is why the inquiry is so strong as well on CBD, because of the positive side effect profile that it has, and as well as the effectiveness of the plant as a medicine, or the cannabinoid, as a medicine targeting polymyalgia inflammation, or inflammation caused by polymyalgia. Now, for anti-inflammatory effects, I personally believe, now this is just my personal belief, okay? I'm not a doctor. Of course, make sure you consult with your doctor. Make sure your doctor is actually pro-cannabis as well, because you get some doctors who are anti-cannabis. So make sure you have a pro-cannabis doctor before you make any health decisions. But the way I see things, let's say if I had polymyalgia, or if one of my close family members had polymyalgia and they had a choice between corticosteroids and CBD, I would definitely sway them towards the path of CBD, if they're open to listening to me, of course. And your best option, I personally believe, is either a full spectrum CBD product or a broad spectrum CBD product, because CBD by itself is shown to alleviate inflammation in varying cases. Now, for both anti-inflammatory and pain relief effects, your best option is obviously a full spectrum product with a 1-to-1 ratio of CBD and THC. However, there is a legal challenge with that particular recommendation. You see, your challenge with acquiring a full spectrum product with a 1-to-1 ratio of CBD and THC lies in the current regulations surrounding THC. So THC is kind of like the boyfriend you can't introduce to your parents, right? Because that's the way I look at THC, and CBD is the boyfriend you can introduce to your parents. So THC is like the bad boy, CBD is like the good guy, the good boy. The maximum legal limit of THC at the moment is 0.3% in a cannabis-based product. However, your next best option is to find a full spectrum product with as close to a 1-to-1 ratio as possible. So maybe 0.3% max of THC, and then whatever the CBD content is. But regarding polymyalgia, I personally believe a smart approach would be to just target the inflammation as opposed to going for the pain, because I believe the pain is as a result of the inflammation. So just target the inflammation, and to do that, I would recommend, I wouldn't be too concerned with how much THC is in your CBD product that you're purchasing. I'll just be looking at obviously the quality and the concentration of the CBD that is in the CBD product or the cannabis-based product that you're purchasing, relative to how much pain or stiffness that you're going through if you've been diagnosed with polymyalgia. So reducing inflammation, in my eyes, will lead to a domino effect of the other symptoms falling away as well. So if you reduce the inflammation, you reduce the pain, you reduce the stiffness. That's the way I see it. But of course, make sure you consult with a pro-cannabis practicing medical professional before you make any health decisions, because I'm not I'm not that person. Okay, I'm just a guy who's curious and looking for answers and broadcasting my answers in a way that would hopefully benefit you as a listener or a reader of my blog. So hopefully this podcast was of some benefit. Hopefully it brought you some insight and some clarity, and it will help you make better decisions. And hopefully, if you don't have a pro cannabis doctor, this will encourage you to actually go find one. Because I personally believe in cannabis as a whole as a medicine. Right? I personally believe that cannabis can get rid of a lot of pills and pharmaceutical drugs that we have, but I also believe that we need to understand how this plant actually works first before we just before we hurt ourselves, because I think the more we understand, the better we can actually use it, which is obviously common sense. I'm not saying anything new here, but hopefully, as I present this information every week, it helps you make a better health decision. Anyway, thank you for your time and your attention today. I truly appreciate it for every person, for you listening to this podcast. I really hope that I am of service to you and this is of value. Take care, God bless, and I will catch you in the next episode. And again, for all the reference links, every single study that I mentioned, everything that I talk about is all referenced on the HempNerd.co website, or the blog there. Everything's going to be on there. So if you want to go nerd out on some of the studies that I find, all the links will be there for you to follow through and nerd out on. Otherwise, take care, God bless, and I will catch you in the next episode. Peace.